Almost 2 years ago, I made a video about how my wife had been unable to walk or exercise for almost a year. So now it's almost 3 years. And some of you have asked me in the comments to that video how she's doing, and she is not doing well at all. There's been virtually no improvement, and we've been through so much and have tried so many things. So over the last 3 years, we've been to over 60 different doctors and healthcare professionals, and none of them have been able to figure out what's causing her pain. None of them have prescribed a medication that actually works to kill the pain. And now the latest is they think she has complex regional pain syndrome, which is it's in your head. And now she's going to a couple people who are trained in pain reprocessing therapy. And they talked to her over the phone to the tune of $120 to $200 per session. And so far, it hasn't been helpful whatsoever. However, we're hopeful, but I think there's something physically wrong that was caused by the mRNA vaccine that has affected her cells somehow that can't be detected by any of the tests she's had. I'll get into why I think that a little later in this video. She did have nerve decompression surgery done in April of 2023, and it didn't help much. And apparently he did a release of the peroneus brevis and longus tendons, or the things that were entrapping them. And unfortunately, this didn't seem to be all that effective. She has had ultrasounds, x-rays, MRIs, CAT scan, EMG tests, testing of the blood pressure in both her legs, and reflex and strength tests, and there's nothing showing up as being wrong. She's been put on various medications, none of which have helped at all with her pain, and several of them have caused headaches, nausea, dizziness, brain fog, stuff like that. She's also tried several topical solutions, and none of them have helped at all. She has also tried a whole slew of supplements in addition to the medications, and none of them have helped whatsoever. Look at all these. It's crazy. She's also tried several devices, from rubber balls to a massager to an infrared pad to the TENS unit, which she got at the chiropractor, and some bands and foot massager and a stick to do massage. And none of those have helped. I tried a whole mess of other things like ultrasound from the chiropractor, fibula head adjustment by the chiropractor, acupuncture, cortisone injections everywhere, caudal injection, SI joint injection, Reiki, Qigong, massage several times, myofascial release. She's been to physical therapy a few times, and it usually makes things much worse. She's tried riding the stationary bike. That doesn't help. It actually makes things worse. She's tried just plain walking. That makes things worse. Nerve decompression surgery, I already mentioned. This has all been a wicked toll on her mental health, so she's been to several different mental health programs. And she even tried the hyperbaric chamber, which didn't help her leg pain, but did improve her eyesight. So we don't know where to turn now. There is this guy out in Colorado named Dr. Anderson from Anderson Podiatry, who had a patient named Kim who had a very similar situation to my wife's, and she went to this Anderson Chiropractic, and they did a whole mess of surgeries. So in her first surgery, she had that done, and that done. And then she just had a second surgery where she had that done, and that done, and that done. So we actually had a phone consult with Dr. Anderson, and at the time we were not on Medicare. And although he takes insurance, he didn't take the insurance we had. We would have been out of network. We decided to go with an in-network guy and have the nerve decompression surgery done. He did something a lot different from what Dr. Anderson did to Kim. Now, I haven't seen Kim walk. If you're going to go through all this surgery and not be able to walk, I'm not so sure it's the right thing to do. I don't know what the solution is. I don't know where to turn. My wife is very distraught about this whole thing. It's coming on 3 years, and For someone who used to be so active, had hiked half the Appalachian Trail fairly recently, and was an ultramarathoner and a marathoner, and just all of a sudden to go from perfectly healthy to really disabled is, without like a car accident, is crazy. I'll tell you why I think it's the COVID vaccine. 17 days after her first shot, she got this pain in her leg, and it went away after like a month. And then 17 days after her booster shot, the pain came back and hasn't gone away for 3 years. So if anybody has any suggestions, please let me know. Or if you know of a clinic or something where you could go and spend a month there and see a doctor every day or 2 days or whatever, instead of like, our appointments are like 6 to 9 months apart locally. If we go to Boston, they're much better, but locally, it's absolutely ridiculous how you can't get doctor's appointments around here. So I'm going to include some video of her describing her current pain. Initially, it seemed to be just the left knee, and now it's the entire sciatic nerve, right from the buttocks above your crack all the way down to the toes. So here's her describing her pain as it stands today. Tell me where your pain is.
From my ass, all the way down here, and all the way into there. And I haven't had this bad pain in a couple weeks, and it wasn't anything wrong about my head. And there's nothing to stop the pain. Okay. Do you think that you could put some more covers on me?
If you have any ideas, please let me know. Please let me know. Or if you know anybody who's solved this issue, please let me know. Thank you very much.